Hi, it's Dr. SamDxB. This evening I want to talk to you about disc disease or disc protrusions, disc herniations, disc extrusions. There's many different stages of disc disease and it's very confusing for all of you. I want to talk about the condition itself. I want to talk about how it's caused. I want to talk about the symptoms that you might have or you might come to clinic with. And I want to talk about the consequences if you don't take care of it early or as soon as you know that you have one. You might go along with many years having different symptoms such as numbness, pins and needles, tingling, or severe pain in your leg or in your arm depending on the area of the disc herniation. And only after a few months or a few years you go to doctor and you get an MRI or CT scan and doctor tells that you have a disc herniation or disc protrusion. But the first stage of disc disease, which is the disc bulging or bulge. And when we talk about the disc disease, it's very good to take an example of an onion because the disc really looks like a sliced onion. The onion really looks almost exactly the same as disc if you take it out of between the vertebrae. You have different layers, you have many different layers, and all these layers are very elastic and their job is to basically absorb the stresses, the trauma, the injuries, the daily things that we do, and as the disc absorbs the stresses, in a time you can start having a little bit of breakage of each layer. And what happens that the inner layer starts pushing through each consecutive external layer and makes its way through into almost to the outer layer, but not beyond. It's just in the inside of the outer layer and it's causing a little bit of pressure at the side. And obviously and outside of this outer layer you've got the nerves which are running into from your neck to your arms or in your low back, and they're running into your legs. So you can have numbness, you can have very occasional pins and needles, you can have tingling. Sometimes the symptoms can be very severe depending on the size of the canal where the nerves are running. At this stage the symptoms usually are fairly mild. You might have had some mild tingling in your bum, you might have had a little bit of leg pain or tingling down to the calf or in your toes. You might have had more of a chronic low back pain because as this condition is progressing, at the same time you have weakness already in the lumbar or the low back area, which is causing localized low back pain or inflammation and so forth. Next comes the second stage of disc disease, which is called disc protrusion. Protrusion, as the name implies, means that if we look at the onion again, the inside material, which is like a jelly kind of consistency, has actually pushed through the disc, and it's usually just it's still almost in the inside, but some of the material might be slightly outside already, and it's protruding. It's making the out layer push stronger into the surrounding nerves and structures and ligaments and so forth. At this stage usually there is more inflammation. There is more inflammation of the ligaments, there's more inflammation of the connective tissue, and the symptoms very often are more constant and more intense and persistent, which might include, again, as I say, tingling. The tingling might be constant. Very often people have night pain at this time. They might have a loss of sensation. Some of the people might actually start having some loss of strength on a muscle, or they might feel that the muscles in a gym, the leg don't perform the same way as before. At this stage, obviously, most people, they start getting worried and they might go to the doctor. The doctor might say that they have a sciatica, but unfortunately, as I've seen as well very often, most people don't do anything about it, even if they get the diagnosis. Remember that the diagnosis has no value if you don't do a treatment or if you don't take care of it. Diagnosis is there, then the diagnosis serves for you to take the next step and form the treatment plan. Of course, it's not your job, it's a doctor's job or rehabilitation specialist's job. But what sometimes happens that, unfortunately, people decide to ignore these symptoms and they think, well, because the treatment costs a certain amount of money, I wait and I see what happens. But at this stage, the condition is chronic already. You won't get away just by waiting, because there is a certain amount of scar tissue, adhesive tissue. There is intense inflammation at the time, and you can rest it. You can rest the area, but as soon as you start doing activity, so you go back to work, the symptoms very often they start again within the next few days or a few weeks. We talked about disc bulge. We talk about disc protrusion. Now we're going to be talking about disc herniation, which is the third stage, and in this stage things are getting a little bit more serious. Well, very often for many of you it's getting to the point where you can't take the pain anymore. And at this stage, let's take a look at the onion again, or let's call it the disc. At this stage, the inner nucleus, which is bearing most of the weight, has actually pushed its way through, being really pissed off of all the stress, and boom, it's going to push its way through until the material, just imagine that this material here is pushing its, oh, that was brilliant, that looks good. It's pushing its way through into the canal. Now it hasn't dropped off yet, but it's pushing its way through. And it's pressing on the nerves outside. Imagine that you've got a canal running from up to down, from top to bottom where your nerves are. And you've got nerves coming out of right next to the disc. And it's pressing on the nerves. At this stage, usually the pain is really constant. It's more intense. Many of you can't sleep anymore. And what you find out that you might be able to work in the daytime, but when you go and you sleep and you rest, you can't rest because the pain is so intense. Whether it's in your neck, whether disc herniation is in your neck, or whether it's in your low back, the disc herniation at this stage is in your neck and you feel the arm pain, or whether it's in your low back and it's radiating down into your bum and in your legs, in your calf, in your feet, it's indifferent. At this stage the condition is chronic. It is irreversible with rest. You will not get away with it with the rest. You would have to rest for a long time, and rest actually is the worst thing you can do for it, because as you're resting, the surrounding muscles which are giving you support, you're taking them out of action. You're making them lazy, you're making them tired, you're making them inactive, and as a consequence the ligaments that are the second structure which is supporting your back has to take too much stress, and that the ligaments are getting too stressed and too inflamed. So the condition with the rest only at this stage, you will not get away with it. And very often your option at this stage is either surgery or go to a serious rehabilitation. Most of my patients at this stage, because most of the patients have ignored the symptoms for the last 2 or 3 years or even longer than that. And it's unfortunate that there is no better education about this condition, and I hope that you take this educational talk that I'm doing now a little bit more seriously. If you do have these symptoms, if you have this condition, and if you think that you're suffering from these conditions, send me a mail, send me an email, send me a Instagram message. I'll be so happy to explain what's going on, what can be going on, or if you might have some other kind of condition. Options for serious rehabilitation and recovery is chiropractic, and it has been scientifically proven to work for disc herniations very well. Most of my patients who are coming for low back problems or disc problems are already having a disc herniation, and at least 80 to 90% of them get good response and go back to sports. I see people with disc herniations daily, and I'm glad to say that the results are excellent. There is no always need to surgery. Don't take me wrong, there is also people who need surgery. But why don't you explore the non-surgical option first? And I will be certainly telling you if I can't help you, but the surgery should be the option for you. I will never pretend to be able to help you if I think I can't. I do have patients who I need to send for surgery, and luckily I have many more patients that I can help without surgery. I have a disc herniation. I didn't take care of it. I was idiot. I was ignorant, because I thought I'm going to go to my colleagues. But each time I had time, they had gone home already, and I did exactly like many of you. That I just waited and waited. Now I've got a numbness, pins and needles, tingling, but I've taken care of it now for the last 4 weeks, and actually I can sleep now better. My arm pain is almost gone. I've still got a little bit of pain in my shoulder, but yeah, I haven't been good to myself. And here I am sitting with arm pain, just like many of you who come to me. So doctors are no better than patients, really.